Today, I'm going to talk about the real challenge facing applied statisticians, data scientists, and analysts. Who's in biostatistics? Oh, nice. Who's in statistics generic? Just statisticians, anyone? Okay. Public health? Good. Sociology, demography, social sciences, psychology? But there's real value in bringing all these together, as you may find out today. I'm going to talk about this real challenge, but I'm going to keep it a little bit of a secret first. And to begin my discussion of what I want to talk to you about, I recognize that you are all students. You are learning some really valuable techniques, biostatistics, data science, etc. It's really, really important for you not only to learn that as, here's what it is, but also how to apply it and use it, etc. But the interesting temptation is that once you get out into the real world, you'll think, oh, I know this technique, logistic regression, or random forests, or this or that. And here's some data. I want to apply it. Well, that model is called, you have a hammer and every problem is a nail. Well, guess what? That's really nothing. You're learning some techniques and you will be in a position as a biostatistician, as an analyst, as a program evaluator or whatever, where the goal is to gain insight and knowledge. And the techniques that you're learning are part of a toolkit that can help you gain that insight. So not every problem is a nail. And recognize that you have a hammer and that maybe you need to expand some of that. And more importantly, that you need to know when your problem can be, you can use the hammer for your problem. And when you can't. So let me start with a little bit of a story. What I'm going to do today is I'm going to tell 3 or 4 different stories that illustrate different aspects of what I just talked about. And then to set up, after the first story, I'll set up a little bit more. And the story happens to be that I was once, and forgive me, I have some census colleagues back here. They heard some of this yesterday. It's a favorite story of mine. I was once on an AHRQ study section. Folks know what study sections are? They are, the federal government gives out grants for research, right? Study sections are the groups that the federal government brings together, the scientists who make decisions on grants. AHRQ is the Agency for Health, Research, Healthcare Research and Quality. And this was back in the 90s. I had, a couple of decades under my belt. I was a Latino statistician with a master's degree, but I was honored to be selected to be in a study section. Usually they only allow PhDs on that. For whatever reason, they got me on there. And I was the sole statistician and survey expert on a panel of about 12.5 scientists. And the way that it works out is that you receive maybe 100 grant applications, and then some are assigned to different people. You do a primary review, there's a secondary review, and then a group discussion. And so I got my reviews, I did them from my lens as a statistician, like, is the design rigorous? Is the statistical power there? Is the analysis plan okay? Are they gonna achieve what they set out to do? And then you begin this process of going through and scoring them. And those with the highest scores get the grant money, and those others, they can reapply or do whatever. And it so happened that it wasn't one of my primary or secondary reviews, but there was a review in there that just absolutely. So this was a case where it was before the Affordable Care Act. So there was a lot of people without health insurance. And the situation was that the healthcare industry was bearing the brunt of caring for folks who didn't have health insurance. So hospitals were suffering, clinics were suffering financially because they were obliged to take care of patients regardless of health insurance status. And there was this problem. So you have folks with a chronic pain condition. Typically, this was before the big opioid thing. Typically, the solution was let's provide some meds and then monitor how they're doing, et cetera. And this one researcher said, you know what, I have this idea that can solve two problems at once for the uninsured. Why not create an alternative therapy from prescription drug, the usual conventional best practice therapy, where we can teach them how to better deal with pain in their lives without taking drugs. And it was transcendental, basically. And so they brought this to the group. It was like a superb statistical design. It was an experimental design. There was a control group of uninsured, a treatment group. One would get the traditional meds, and the control group would get the traditional meds. The other group would get the transcendental alternative that's less expensive. And they, great design, great power, great analysis. A very specific research question, does this work or not? And you got the primary reviewers, oh, this is magnificent, it solves all our problems. You got the secondary reviewers, yes. You got the discussion, everybody was all on board. How many people think it was a great plan? Does anyone think, hey, it solves a problem, right? Okay, well, so I happen to be the only person of color, the only Latino among the research scientists. I was a statistician. I wasn't a healthcare research expert. So I wasn't even an expert in the field, but I was a statistician and I was a Latino. And I knew from my experience back in San Antonio in the neighborhoods, we don't want no alternative care. We want the same care that everybody else gets. So I raised my hand and I said, well, here's a different perspective, folks. I said, I do not believe that this grant application should be funded in the way that it's currently written. I said, if we do that, we are contributing to a two-tier health system where if you have health insurance, step over to door number one. We'll give you the best meds, the best docs, etc. Oh, you don't have health insurance? Step over to door number two and we'll help you think through your pain. I said, we cannot have this. You need to understand what we're doing here. And fortunately, they listened and they basically sent it back unapproved to the researcher saying, you need to reframe it. Because what I said next was that, hey, if this is a genuinely good therapy, open it up to everybody, regardless of health insurance. Make it a true clinical trial. And let's see if it works. I said, hey, I know a lot of people who have health insurance and they don't like to take meds. This could be an alternative for them. And so that's what we did. But the point of this is that I used my whole self. I used my life experience, my culture, and my statistical training to basically inform what I believe to be better science. And the better science wasn't an alternative statistical design. It was reframing the research question. And that was as a result of critical thinking. There's a little, funky master's student. I didn't have a PhD. There was a whole bunch of amazing, wonderful scientists, health research scientists. And because we didn't have the diverse voices contributing to the conversation, it would have otherwise been approved. So there is value. And I'm looking at a lot of diverse faces here. And part of my story is going to be that each one of you has your own unique perspective based on your life experience, your culture, etc. And you need to bring that to whatever you do, even if it's developing a statistical programming analysis for XYZ. Think it through, etc. So that's my example of how we need to think differently about research and how it applies to you, all that you're learning in terms of the technical aspects of your degree. So the second story is really focuses on another diverse perspective. It has to do with actually one of my greatest failures as a professional. So, you look at me and you say, hey, here's this, the director of the Census Bureau, Senate confirmed, first Latino. And you might think, oh, he's had a really successful career. But I promise you, every person in these types of roles, every successful person has been through a sequence of failures that they learned from and they went forward. And in this story, I want to talk about this greatest failure because it was back in 1999. There was something called the Health Survey Research Conference. It was sponsored by the CDC. They would bring all these survey researchers, like of the highest magnitude, like these world-renowned researchers in, as well as a lot of federal funders. And I had just started at the Urban Institute in the first of 2 stints that I had there. And I said, man, I'm going to go here and I'm going to make an impact. And it was at the time that there was the first inklings that cross-cultural research really mattered. And so the story I wanted to tell had to do with measurement in survey research. And it turns out that there is if you take a look at sort of the standard health batteries, there's something called the SF-36. Look it up. It was created by Rand back in the early 90s. And it's 36 different questions. And one question in particular just screamed out at me. It was a question on daily activities and mobility. And it said, oh, question is something to the effect of, oh, you have, how active are you in your everyday life? Do you, do you climb stairs and do you do this and do you do that? But something just jumped out at me. It also said, and do you do exercise or do you engage in recreational activities like bowling and golf? Bowling and golf. Early 1999. This was the instrument was developed in 1992 before Tiger Woods existed, before golf became popular. So where was golf played? Country clubs. Who goes to country clubs? Well, it ain't the folks in the Bronx necessarily. Back then, it was bowling. Even bowling is actually historically a working person's type of activity. But even back then, I used to watch bowling on TV when I was a kid. There wasn't a lot of diversity reflected there. So you basically had an instrument that was used for the entire United States, and it was then adapted to other countries. It was used internationally, where it was clear that the perspective of a certain type of person was being used to create the measurement. Now, that's perfectly fine. People should use their own perspective. I just talked about it. Use your own perspective, bring your own self. But what was missing in that was a diverse perspective. Why, it shouldn't just be the country club, intellectual that creates the question. They should at least vet it and talk to community members about what is it that makes sense to you. Otherwise, it's going to be a bad measure. It'll capture something. You can get people to answer the question, but it really won't be getting at what you think you're getting. So I was prepared to go and basically say, look, folks, here we are. We've come a long way with research. We do experiments, etc. But we need to recognize that the way we are structuring our research, the way we are teaching our students is through a lens that values repetition. So you have the SF36 measurement. It's used for national surveys. So if you're a grad student and you're doing research, what are you going to do? You're going to look at the literature. You're going to say, what's used? Well, it's this question. So I'm going to put it into my questionnaire, regardless of whether it's obviously biased from a biased perspective. I said, we are promulgating an inherently biased way of doing things without allowing students and the public to weigh in on what is relevant to them. And so that was my perspective. I ended up going in there and then something awful happened. And I'll just be real short with it because it's actually fun. It's an illustration that failure leads to success. So I walk into this auditorium, about 300 people in it. It was the first time I had ever been in an auditorium that was circular like that with all the seats going up. And I was at the bottom. And so I walked in and I looked up and I saw all these faces staring at me. And I literally had the only panic attack that I've ever had in my life. I couldn't talk. My tongue got thick. I was sweating. I was talking slowly. And I was able to barely get some of the points I was trying to make out. And I lost all sense of time. So you know how you have a moderator? They came up to me, they grabbed my arm and said, I'm sorry, your time is up. And they led me back to my seat and sat me down. And it was like, And then it was discussion time, right? The audience starts getting up and basically screaming bloody murder at, oh, I disagree totally with you. You're wrong. No, we do good science, blah, blah, blah. Refusing to acknowledge the value of the element that I was speaking to. And then right after that, it was a buffet lunch, right? So I was ready to run into my room and, and like check out and just leave because it was the first of a 3-day conference. But I said, no, I got myself into this. I'm going to stick through it. So I got up and I went into the crowd. And as I was serving myself my buffet lunch, people were coming up to me and saying, I disagree with you. How dare you? And I'm like, okay. And then I had to go find a table that would accept me. And everybody was looking away. And I finally found some folks that took pity on me. And I finished up the conference. But so I had a failure, but my message was, I think, pure. That is that we need to recognize that things like editorial boards, things like study sections, decision makers without the benefit of diverse perspectives can actually lead to poorer science. You can excel, you can do better science, better measurement, more relevant measures if you include diverse voices. And guess what? Each one of you has a diverse voice, and you need to use it even if you're not a subject matter expert in the thing that you're helping out with or you're leading. Okay? So that was the story. Next story, and this is going to be an interesting one. I hope you think is about clinics. So again, this was in the 90s. That's when I did a lot of my big thinking. 1990s. I was on an HRQ panel. I thought big of myself. I should have. And I was reading an NIH newsletter. Okay. And I looked at this and I saw a listing, like a little summary blurb on a research project. It was a research project on Spanish-speaking people going to clinics and how to help them out. And there was a little experimental study, and they just gave the blurb of the results. And they said, guess what? If the health workers, either the doctors or the nurses, know even a little bit of Spanish, the patients are getting better outcomes than if they didn't know any Spanish. Okay, people aren't laughing. So it's like, come on, give me a break, right? Now, at least that's what I initially thought. But then I realized something that I think was absolutely profound. And I hope you think this too. And it was that this was the first time I had ever seen a government-funded research project that showed that the institution was acculturating to its population. We were becoming more diverse by then. We were growing in diversity. So this was an instance where, hey, the institution shouldn't just say, it's your responsibility, come in. You don't know English, that's your problem. Here's our best, advice. If you don't understand it, that's not our problem, next person, next patient. And they were saying, hey, we are committed to creating better outcomes. So we're adapting. Now, I think that that's pretty profound, and most people missed it. I actually told a National Academies panel they were doing something on the next 10 years of racial disparities on healthcare. And I wrote back to them and I said, this is all great, but you're focusing on one of a two-party system. There's the patient and there's the caregiver. You can't just look at one. The outcomes are the result of the interaction. We need treatments for both of them. Why aren't we looking at those types of issues for the healthcare industry? And if you think about it, it really applies to all of our governmental functions. We like to think about, oh, we have, programs for this and that, and we do, clinical trials and education programs and this and that. But all too often, the focus is on one of a two-party system where it's the interaction that's actually making the impact on the outcome of the patient or the student or the whoever you're trying to help. We need a more holistic system in terms of the work that you will be doing. A lot of the work is going to be in the healthcare industry or in clinical trials, pharmaceuticals. You need to think through that there's two parties. And if we just attend to one instead of the other, you're almost guaranteeing failure in the long run. Yeah, it might work for a little while, but the same thing is true of another blurb that I saw, which was cigarette smoking. So, there are campaigns to end smoking, right? And back in the 90s, they said, oh man, we developed this wonderful tobacco cessation program. And we're going to try it on a Latino community population. And so they did it. It worked nationally. And at the time, majority of the population was white. It worked nationally, but it absolutely failed in the Latino community. And so they did some research, and guess what? They changed the program from being, I don't know if you've seen these commercials, this is your brain on drugs. It's like very individual. This is what happens to you, okay? That program works maybe for certain populations, but when it comes to Asians or when it comes to Alaskan Natives or American Indian populations or Latinos, those populations are much more community oriented. So the messaging that worked for those populations was, this is what you're doing to your family. This is what you're doing to your kids. That worked. But the individual thing, hey, I take my own risks and I'm stressed, so I'm going to smoke and I'm helping my family by working and things. But if you switch the paradigm to address from a culturally relevant perspective, then you could actually get better outcomes. So and how did that come about? It wasn't somebody sitting in their office thinking, here's a new program. It was through community engagement. It was by talking to people. It was by developing and growing that culturally relevant perspective. Let's see. So those are a couple of instances of that. And let me tell you another story. And this one actually looks at a different aspect of everything I've been talking about. So I've talked about how you bring your whole self and your culture and life experience to use to reinterpret results as well as to apply good research questions and good research. Here's one where you use your values. So I was at NORC, the National Opinion Research Center at University of Chicago, and I was a vice president on research. And one day, the country of Brazil called us. It was at the embassy. And what they did is they said, I have $500,000 and we want to do a survey. And so nobody wanted to go to DC. It was in Chicago. And so they said, Santos, you know, it's close enough to being Brazilian. Get your butt out there and go talk to these guys. So I got on a plane, went down to Massachusetts Avenue in DC, went to the Brazilian embassy, which is beautiful, and then walked in and I met one of the foreign ministers. And he introduced himself to me. We sat down and we had tea. And at the end of the tea, we chit-chatted and he said, look, the country of Brazil has this amazing economy. It's like 5 times bigger than the Soviet Union or Russia. But the US doesn't appreciate it. No one recognizes how valuable that Brazil is as a country to the global economy or even to the US economy. So we want to do a survey to explore, why people, how many people understand and how many people don't understand the Brazilian economy in the US. And we have $500,000. We want to give it to you and we want to get started. How many of you would say, grab the money and run? I mean, we're on soft money at NORC. We survive by getting projects like this. But my values, my ethics, I love 2 things in life, statistics and helping people. I could not do that. So what I told the minister was, look, you don't need a survey to tell you. I can tell you right now, no one in the US knows about the Brazilian economy. No one cares about the Brazilian economy. So you don't need to spend $500,000 to find that out. Now, you could explore what is it about the Brazilian economy that might resonate with the US population. But that doesn't require this big national $500,000 survey. Do some qualitative research. You need to be, like I said, toolbox. There's a qualitative component that doesn't have to yield statistical estimates, but can yield knowledge and insight. Qualitative research. Do some qualitative research. Find out what people are thinking. Find out what might resonate with them. And then maybe go into, in the Northeast, there are pockets of Brazilians who have migrated and made communities. Maybe do some surveys of them and find out what they're thinking. And I said, but you don't need a survey. I'm sorry. I couldn't do that. And that was because I leveraged my values and my life experience to make those decisions and to do what I thought was the right thing to do as a statistician and as a scientist. It was ethical. It was the right thing. So I did that and I went back and they pretty much yelled at me, like, what are you doing? And I don't know whatever happened after that because then I went over to the Urban Institute where I had my crash and burn type of excitement. So there you go. I've talked about my values. I've talked about my culture. I've talked about my life experiences. And in the meantime, I think I was a heck of a sampling statistician and a survey expert. And I was always giving advice on those types of things. But I brought my whole self to the. And that's something that I want to leave with you in terms of my story here. So please, please, please learn your trade, learn those techniques, absorb them, understand their strengths and limitations. But don't forget that you have a brain and that you are obliged to do critical thinking. And the critical thinking isn't what would my professor think? The critical thinking is, what do you think based on your life experience and your culture? Because that's what gives you the unique perspective that no one else has. And you'll find that you will be a more valuable partner, you'll be a more valuable leader, and you will do better research if you use critical thinking that's propelled by yourself. And that's the story that I wanted to leave with you today. And I guess I'll take questions after this. So thank you very much for listening to me. First question.
Yeah, I've been wondering a lot about this, what you said in your first story about validated scales and validated measures. And in my experience, I've come across a lot of validated measures that I don't think are necessarily used in the appropriate way, or maybe they used to be appropriate and in the past 50 years, they have become less relevant, but they're the only measure that's validated. So like, how do we move past that?
So what was the question?
Oh, how do we move past that?
Well, the way you move past that is to decide for yourself as a researcher, what type of insights do you want to create? How do you want to advance the knowledge ball down the field? Do you want to replicate something that you can compare to other data sets and past research that may not have relevance or real value and insight in terms of how to create a program or improve society or understand who we are? Or do you want to change things up, create what you believe and what you can, through methodological research, you can create a validated new scale or new way of measuring things that you can tell people, look, there it was the old way. This is how it really, here's what I think is a better, not how it should be, but here's a better measure. And here's the insights that we can get from that, and then move forward. It's really a subjective judgment on your part. I can say that type of subjective quest for knowledge will vary dependently. There are some economists that, I love economists in the world, but they do not want to alter their time trend from back in 1940. And so we're going to ask the same question, whether it's relevant or not. I mean, just think of the race and ethnicity questions. So back in the 40s and 50s, and maybe even before that, we had the question on race that featured white, black, and then other types of races. But it had black, right? Well, up until maybe the 90s, the overwhelming majority, 99.9% of African Americans were African Americans from the US, basically, descendants from when they were forcibly brought over. And it worked because we knew that population. Fast forward to 2020. Well, we've had refugee and immigration programs that bring in folks from different parts of Africa, Middle East, etc. And you have literally about 10% of the Black population that is no longer ancestors from folks who were forcibly. You have mixtures, as well as folks from Somalia who came, and they have their own communities, their own families and such, and other countries and such from Africa. And that question, you're capturing information. Everyone's going to say but not everyone is going to say they're African American. And there actually is a need for us to understand a disaggregated Black grouping. So that's something that the Office of Management and Budget is now contemplating. It would, the one question was relevant back then, it's not no longer relevant. So that's an example of how things change over time. The same thing, I talked about this morning, so if you already heard it, close your ears, about something as simple as monthly household income, right? So back in the, when these, pretty much standard question on, current population survey, American Community Survey, all of our surveys, what's your monthly household income, right? Now, back when those questions were first designed, we sort of had the life and the economy where almost all people, if they were employed, they got either a monthly or a biweekly check. Fast forward to 2020, we have higher rates of poverty. We have different gig workers. We have episodic workers. We have folks that have 2 or 3 temporary jobs or 2 or 3 part-time jobs just to make ends meet. Suddenly, combining with gig work, asking what used to be a very simple question about, hey, what was your monthly income last month? Now becomes very complex. And it ends up that the people that we need to know the most about, the most vulnerable because of the income vulnerabilities, are the folks that we measure the least, because it's really hard for them to say what they made this. So those are examples of how things seemingly used to be standard. We don't need anything. We need to be constantly rethinking on how to measure and whether it's still relevant or whether different methods need to be used for different subpopulations to more accurately capture the information. Other questions?
Yes. So, I guess it's a follow-up with what you just told us, and I resonate a lot with your story about the measurement. Because I have this great example from my psychometric professor. His expertise is on mental health and stigma on Asian population. And in Chinese saying, there's something called lose face. But when you say English, you have no idea what does that mean. It actually means like brings shame to your family. And when he implement this measurement in Chinese, and when in English, there's no direct word of translating this like nuance in the culture. So I was wondering, like, when you design a survey or measurement, like I assume like when you're doing a census design, you definitely have like this measurement to capture different population. How do you address this like nuance in the cultural differences?
That is such an exceptional question. Thank you so much. It's something that I've been struggling with as well. I was once on the Census Advisory Committee back in 2000. It was on 6 years. I even chaired it 1 year. And the first day I was there, I said, I have a suggestion for the Census Bureau. We should be doing Spanish language pre-testing to look at exactly the same issues. Do these things translate? And the last day I was there 6 years later, I said, excuse me, we still need to do Spanish language pre-testing, and it never happened. Now, since then, it has started happening. But it's really tough to get out of this paradigm that we start with an English questionnaire and English and sort of Western concepts, and then translate them into something else after we're finished doing all of the reliability, et cetera. When in fact, maybe we should be doing other languages simultaneously to make sure that they're valid. And maybe even for some concepts, start with a non-English version and then translate it into English, because that might be an easier jump. We already see this, for example, with mental and physical health. There are some Southeast Asian cultures, and there's Native American kind of cultures where mental and physical health are not separable. It's one concept. And so when you start asking a battery of mental health questions and physical health questions, it's totally confusing. So you're getting people to answer the question, but really, are you capturing the information? So I acknowledge we need more of that. We, especially because our nation is becoming wonderfully diverse. Now more than ever, we need to move in that direction, do those things. We're not there yet, but with your help, we will. Other questions? Yes.
Great. So I love that you're able to bring your whole authentic self to all the spaces that you operate within. And I'm wondering what might be some tips or areas of guidance that you could offer for those of us who are emerging, right? So many of us are junior in one capacity or the other, wanting to bring our full selves, but also working to integrate into systems that may not be totally open to that full self. So there's a way in which there's an art to what it is that you've described that you've done. And I'm wondering if you could share some tips for those of us trying to do that.
Yeah, well, I mean, my pathway ended up being that I had something called ganas. In Spanish, it's desire. And my desire over to do better and to do my love of statistics and helping people overcame things like I was extremely shy. And I really had problems talking in front of people. I had problems even speaking up in meetings. So when I was a graduate student, I was incredibly shy. I also had something that you might, I don't know if you're familiar with, called imposter syndrome. So I totally thought that everybody was going to figure out that I didn't. They were going to just dismiss me. And that lasted for about 10 years. But what I did is I approached it by saying, okay, I acknowledge my fears and I'm going to work on them. So for example, when I was a grad student at Michigan, I got into the infamous, the renowned Institute for Social Research. I was in the sampling section of the Survey Research Center, and I was working on the first ever national survey of people of Mexican descent, and I was going to draw the sample for that. I'd go into these meetings with all these other grad students, and there were Latino grad students, and they were so profound and just had such insights that I would just sit there. I was the statistician, non-expert, and I had, psychologists and folks in education, et cetera, or grad students, as well as the researchers in these different areas, multidisciplinary areas, subject matter experts. Like, man, what can I offer? But I really wanted to be a part of the group. And I was incredibly shy. So I said, okay, I'm going to go to this meeting and I'm not going to leave unless I ask a question. That was me being vocal. So I would do that. I went and I asked a question, and regardless of whether it was a silly question or whatever, they would respectfully, answer. They were my colleagues. And I did that for a few times. And then I said, okay, this next meeting, I'm going to make a comment, just one comment. And so I started doing that. And I slowly acclimated myself to becoming vocal in those settings. I also had in my Department of Statistics, I learned mathematical statistics. That's what my master's degree is in. And, the seminars, what you do is you take a journal article, it's all math stat, Greek symbols and all of that, measure theory and functional analysis and all that. And I was supposed to go and present, the findings. Here's the problem. Here's all equations on a blackboard. Remember, this was back in the old days, guys, on a blackboard. And so my very first seminar, I grabbed the paper. I looked up. It was only like 8 or 10 people there, and a couple of professors. I was so nervous. I grabbed this long piece of chalkboard. I went up to the chalk. I went up to the chalkboard. I went like that, busted the chalk, and it was flying out. And I stumbled through that thing. And then I said, okay, it was almost, but it wasn't a panic attack, but it was almost the panic attack I had like 20 years later. And I decided, no, I know how to do this. I absolutely memorized 45 minutes worth of presentation, practiced writing everything on the chalkboard. And for the second one, I just breezed through. And I said, okay, now I know how to deal with that situation. For the meetings, I figured out a way to deal with that situation. So my approach was incremental, but that was me. The final thing that I learned is that, yes, I was an introvert, but I was actually, there's an extrovert component in me, if you hadn't already. And I didn't realize that because I was a sampling statistician. My first job was to go to Temple University's Institute for Survey Research and design samples, national samples, local samples. I was doing my thing in my little closet type of thing. And I said, man, I want to understand the consequences of my design decisions. So I went to the director and I said, I want to direct a study. And they threw a national sample at me, which involved going out and training. This was all face-to-face interviewing, national. You'd bring together, 50 interviewers in a hotel in St. Louis type of thing, and you'd spend 3 days training them on the study, the material, how to administer the structured questionnaire on paper with bookmarks and all this other stuff. And I found that I loved doing that because my shyness comes from unstructured situations. Put me in a cocktail party and I'm going to sit at the corner not knowing what to do. Give me a seminar to talk about research and I can just go on and on and on. So I learned that in a structured setting with some rules, I can be an extrovert. Everyone here, you'll have you may have your imposter syndrome. You may be shy, you may be this, you may be that. Dig into yourself because each one of you doesn't need some, life coach type of thing. Everything you need is within yourself to figure out how you're going to succeed. And I invite you to explore yourself and your own mechanisms for overcoming whatever challenges. Next question. Yes, sir.
First of all, thank you so much for so I remember you mentioned that you were the only Latinx researcher in the research group. And compared to that period, do you think now the personnel or scholars at the researcher team or the Census Bureau or the methods of conducting the censuses or researches have become changed and reflect the diversity level of our community, or is there still more room that we have to improve our methods?
Well, I'll start off with the last part. There's always more room that we can do. We have come a long way. We're not totally there yet. I don't know that we'll ever be there because no federal statistical agency is perfect. Now, in fact, I say this about our censuses and surveys. No census and no survey has ever in the history of our country been perfect. And that applies not only to all the work and the data that are produced by the federal statistical system, it applies to every survey you will ever get your hands on. It's never perfect. And what brings value is understanding the strengths and limitations. It's kind of like when you buy a used car. You don't expect it to be perfect. It's very useful, has high utility. And the first thing you want to do is to learn all the quirks so you can navigate around those and just do your thing. The same thing with data. You need to understand and explore the strengths and limitations so that you can squeeze as much knowledge and insight out of those data, recognizing the limitations and not taking it too. That's the same with all of our census data that you're going to have to learn when you use it to make these wonderful insights that you're going to. Yes, sir.
I was wondering, so I always try to encourage my students to not only get a degree, but also to get some experience, because once you're on the job market, they want more than just a degree. And so if I were a master's student right now, how might I be able to get involved in the research? Or are there training programs available? Or what if even I just wanted to analyze data? Where are there websites where I could go to do data?
Yes. You can go to census.data.gov. There's plenty of data sets there for the sophisticated user. Otherwise, it's clunky. But apart from the data that are available it's downloadable. You can download microdata from ACS if you wanted to. Besides that, there are many opportunities to use census data to do research and to find employment or opportunities of learning from the census. We are currently sitting on 1,100 vacancies. If you have a master's degree and you are not going further, you might want to consider going further. But if you don't, if you're a statistician, we have jobs for you. If you're a biostat, we have jobs for you. If you're a psychometrician, we have jobs for you. If you're a demographer, we have jobs for you. If you're in HR, we have jobs for you. If you're in, in the field doing interviewing, we have jobs for you. In fact, we have our regional office director for New York, Director Dickinson, that's here in the back, along with Jennifer, her associate, and they can talk about the opportunities that are available here in New York today with regard to part-time field representative jobs. Want to say a couple of words, please?
Okay, well, first, good afternoon to everyone, and thank you for joining us today. As Director Santos mentioned, the census is always hiring, and we hire on so many different levels, and we do understand the importance of knocking on a door or maybe dealing with some of the surveyors who are in the field. So currently we're hiring for field representatives and field supervisors. That is field work. So that is the groundwork that is actually knocking on the doors and talking to the respondents. Additionally, in the regional office, we are hiring survey statisticians and survey supervisors. For some of you who may still be in school and may not have matriculated out, we do have some junior level statistician positions that will allow you to understand how the census works, and also will let you see how we collect data and some of the ways that it's processed. So USA Jobs, I'm not sure if anyone is familiar with that website, but usajobs.gov is actually where all of the career professional jobs are located. So very easy to use. USA Jobs allows you to actually build your resume right within that website. You can actually indicate your preferences as far as specific jobs or agencies or different grades or pay requirements that you have, and it will automatically send you those positions based on your preferences every single week. So I would encourage everyone in the room to definitely check out census.gov/jobs. It will talk about both the jobs in the regional office and direct you to our career professional jobs with the Census Bureau as well.
And just to put in a plug for my sister federal statistical agencies, you can find jobs for all of the federal government, including Bureau of Labor Statistics, National Center for Health Statistics, NCES, National Center for Education Statistics, all the way down the road, National Agricultural Statistical Service. And there are jobs everywhere, and they are available today for people at the master's level and beyond. We also, by the way, have internships. We have limited internships for this summer and the fall that we can make available to your professors, and they'll tell you how to explore those. And we're looking to create a more robust program next year that will have a much greater impact and much wider availability. So please look out for those. Other agencies as well have internships, so please, federal government is a really great place to start.
Great. So first of all, let's thank Mr. Santos for a wonderful. Very, very powerful message. And for students, it's not over now. So we have another program at 3:15, which will be a more informal discussion. But thank you all for coming, and thank you again, and thank you for the team, and thank you all.
Thank you.